Hey everyone, and welcome. Today, we're going to tackle a big topic: the difference between chiropractic care and what you might call traditional medicine. It's something that sparks a lot of curiosity and questions, so let's jump in and get some answers.
So this is it. This is the question that, according to our source material, comes up more than any other. How is what you do different from going to my regular doctor? It's a great question, and for the next few minutes, we're going to unpack it piece by piece.
To really get to the bottom of it, we're going to look at 5 key areas. First, the whole philosophy behind it. Then, how each approach finds the real problem. After that, we'll compare how they treat pain, fixing versus just masking it. We'll look at the long-term goal, and finally, what it's actually like to work together as a patient. Okay, first up, let's talk about the foundation of it all, the philosophy of health. This is really where the two paths begin to split, one heading towards proactive wellness and the other focusing on reactive treatment.
Here's where you see two totally different ways of thinking. The chiropractic view is really built on this core belief that your body has an amazing ability to heal itself. The job is to find and fix whatever's getting in the way of that process. On the flip side, the traditional medicine model described here tends to step in after a problem has already shown up, and the focus is on diagnosing that specific condition and then treating the symptoms it's causing.
To make that difference super clear, the source gives us a great analogy. Think of it like your car. The goal of chiropractic is framed as actually fixing the engine when something's wrong. In contrast, treating just the symptoms is kind of like seeing that check engine light come on and just putting a piece of tape over it.
All right, let's move on. If the starting philosophies are so different, it only makes sense that the way they figure out what's wrong would be different too, right? So let's take a look at the diagnostic toolkits.
So the chiropractic approach to diagnosis is described as being really hands-on, almost like a detective for your body. The practitioner is looking for clues everywhere: how you stand, the way you walk, your muscle strength. Little things like uneven shoulders or a hitch in your step can tell a whole story about where nerves might be getting pinched and where the real problem lies. The source uses another really helpful analogy here. Chiropractic tools, like the hands-on assessments and posture analysis, are like a magnifying glass. You're getting a super close-up look at how the body's mechanics are working. Traditional medicine's tools, like blood work or an MRI, are more like a telescope. They're looking at the bigger picture, searching for broader signs of disease or injury. Both are incredibly valuable, they're just looking for different things.
And the process itself? Well, it's described as a real team effort. It all starts with just talking, hearing your story. Then comes that detective work we just talked about. And it all wraps up with creating a game plan with you, not just for you. Okay, section 3. We found the problem, now what? How do we go about fixing it? This is another spot where you see a huge contrast between fixing the source of the problem versus just masking the pain.
The toolkits for treatment are just as different as the ones for diagnosis. On the chiropractic side, you're looking at physical solutions, spinal adjustments, working on the muscles, and getting personalized exercises and stretches. The big emphasis here is no drugs, no surgery. The traditional path often involves things like pain pills or anti-inflammatories to manage the symptoms, with surgery being an option for more serious cases.
And here's another great analogy from the source material to hammer this home. If you've got a leaky roof, you can spend all your time mopping up the puddle on the floor. That's like taking pills for the pain. Or you can get up on the roof and actually fix the leak. That's how the chiropractic adjustment is positioned.
What's also really emphasized is this idea of a partnership. The goal isn't just to treat you and send you on your way. It's about empowering you. It's about explaining why you're hurting in the first place and then teaching you how to prevent it from happening again. It's all about giving you the knowledge to take control.
So, what's the end game here? Let's move into our 4th section and explore what success actually looks like for each approach. I mean, what does it really mean to be better?
When we talk about the ultimate goal, the paths really split. The chiropractic goal is described as long-term functional improvement. We're talking about being able to move without pain, sleep better, and just have more energy for life. The traditional goal is often framed as more immediate, getting that symptom under control right now or managing a chronic condition, usually with ongoing medication.
To back up that long-term focus, the source points to studies that show somewhere between 60 and 70% of people with back pain report significant improvement just a few weeks after starting chiropractic care. It's a number that really highlights the impact of focusing on function. And it's not just about feeling physically better. Patient satisfaction is a huge piece of the puzzle. The source states that over 80% of chiropractic patients say they're highly satisfied with their care, and as a result, end up using way less pain medication.
All right, let's land the plane here in our final section. What does all of this practically mean for you, the patient, when you walk in the door? What's the day-to-day experience like?
The source describes a practice model that's pretty different. By often being a cash-based practice, not taking insurance, the whole focus changes.
It can mean more face time with the doctor and a lot less time spent on paperwork. This also opens the door to more flexible scheduling, like same-day or evening appointments. And here's the kicker. Sometimes this can actually cost less than all your insurance copays and deductibles.
And look, this isn't about one approach being good and the other bad. In fact, they can be an amazing team. Take this quick story about a runner named Sarah. Her MD found the problem with an MRI, but instead of jumping straight to surgery, he sent her to a chiropractor first. The result? 6 weeks later, no surgery was needed, and she just finished a half marathon. That's collaboration at its best.
So, after all of that, this explainer really leaves us with a question to ask ourselves about our own health. Are we looking to just cover up symptoms, or are we trying to find and fix the root cause? Understanding the difference between these two philosophies is really the first step in making the choice that's right for you. Thanks for joining us.